This statement by BBC medical correspondent Fergus Walsh has thrust the vaccine debate to prominence.
If they don't get early, quick results in the UK, they're considering a trial in Kenya.
Even though Kenya has had a long history of vaccine use, one thing that never changes is the hesitance and distrust towards these medicines. Kenyan scientists, in collaboration with foreign organizations, have been at the forefront of clinical studies for various vaccines since the 1990s. During that period, clinical studies on vaccines for malaria, HIV/AIDS, polio, Ebola, and pneumonia, just to name a few, have been carried out in Kenya through KEMRI. Dr. Bernhards Ogutu of KEMRI has been involved in the malaria vaccine rollout, which is currently being administered to eligible children in 8 counties in a phased manner.
This was a fairly long journey spanning more than 30 years.
He outlines the benefits for any country that gets involved in pilot studies or clinical trials of a virus.
You are dealing with something that when you are getting into your population to use it, you are certain it works for you. The other thing, by the fact that we're participating on this vaccine development, we become a priority country when deployment comes in.
On the African continent, only South Africa, Senegal, Egypt, Morocco, and Ethiopia manufacture vaccines. And when it comes to developing a vaccine from scratch, that process could take at least 7 years with a price tag of 100 billion Kenya shillings.
This is money that you are putting in and you are not certain of what is going to be the outcome. It can fail or it can be successful.
Kenyan scientists are involved in global studies on vaccines for several diseases. So, should a Kenyan scientist receive a request to study the data on a potential COVID-19 vaccine, then step 1 will be to study that data in collaboration with fellow scientists for verification and feedback. If convinced that the vaccine is viable, the scientists can submit the data to a scientific and ethics review committee at KEMRI that will give recommendations. Finally, if the vaccine's data faces no challenges, then the Ministry of Health and the Pharmacy and Poisons Board will form a committee of experts to probe the data further. Only after those stages of approval can a Kenyan scientist begin to advertise or recruit volunteers for the study.
It is not being brought by any foreigner coming to run the studies here. The studies are run by Kenyans because we have been part of the development and will be just part of the larger global consortium that are involved in this vaccine development. As a scientist, I've been in touch with a number of organizations working on COVID vaccine development. This is a small globe that now we are dealing in, and if we don't participate, then we are left out.
Professor Omuanzala, a virologist and immunologist at the University of Nairobi, has been involved in the search for an elusive vaccine for HIV/AIDS for the last 20 years. And he is quick to counter the widely held perception that African volunteers are guinea pigs for foreign vaccine manufacturers.
That is a complete perception. The first clinical trials we started here in Kenya was in 2001. Uganda started slightly earlier than us. Most of the clinical trials are done in Europe and North America.
He walks us through the 4 stages of human vaccine trials that the COVID-19 vaccine could be subjected to. Step 1 of the human trial seeks to answer the question, is the vaccine safe? And it is carried out on 30 to 50 volunteers who are monitored over a 1.5-year period. The second stage is the extended safety and immune response testing, carried out on 100 to 150 volunteers who are monitored over 1 to 3 years. The third stage is the efficacy testing stage, which could take 4 to 5 years and involve anywhere between 2,000 to 5,000 volunteers. And the final stage of testing looks at the effectiveness of production of large doses of this vaccine and the supply chain and logistics factors.
So for me, all these conspiracy things I keep hearing are neither here nor there. Really, that's not the way we have worked as scientists. We collaborate and we collaborate all the time.
He, however, admits that the vaccine sector took a hit with the polio debacle, where a child died in Limuru in 2015 after taking a polio vaccine, and a case in early 2018 where 1 child died and 4 others were paralyzed after a measles vaccination exercise.
When vaccines reach mass distribution, they are highly, highly safe. But what we have known over time is that majority of the side effects we see in vaccines are usually related maybe to wrong administration of the vaccine.
According to the World Health Organization, Africa, which accounts for 14% of the world's population, only participates in 0.1% of the world vaccine production.
That, to me, should be the discussion we're having. How do we build an enabling environment to start making vaccines here, to start making drugs here?
He warns that unless African countries engage in the COVID-19 vaccine trials, then the vaccines that will finally hit the market will not have factored in the multifaceted African DNA and may prove useless for Africans. Reporting for Citizen TV, I'm Waihiga Mwaura.